Welcome to meandmydocs.com from Handoff Solutions. This is a video tutorial for physicians, nurse practitioners, physician assistants, anyone who will be looking at these studies and then importing them to their radiology information system. So first we'll log in on the top right hand corner here, and then during this video I'll show you very briefly how a scheduler would send an invitation to a patient, what that patient invitation will look like, how the patient would upload their imaging studies from a CD-ROM, and then we'll skip to the part where you will look at these imaging studies, evaluate them, and send them to the radiology information system at your institution. So a scheduler would typically send an invitation by logging in. The scheduler or anyone can invite a patient by clicking on that patient invite tab on the top left. And then they choose the care team provider, the email address for the patient, registration number, first name, last name, and date of birth for the patient. That sends an email to the patient that is an invitation. I'll show you the invitation next. This is an email invitation that the patient would see. It's a simple invitation with a link that they would click to get to meandmydocs.com and start uploading their imaging studies. The patients log on to meandmydocs.com. They go to the Uploader tab here on the top left, you can see, and the product installs a short, very small application to recognize the CD-ROM and help them upload their studies. It takes just a few minutes. Now you'll log on to meandmydocs.com as a provider to look at the studies that they've uploaded. You'll actually get an email notifying you, as will your other staff, that there's a study to be uploaded. This is the view that you have as you log in as a provider, and that is a doctor or a physician assistant, nurse practitioner. We'll just notice that as you log in, you'll see the inbox here. And if you wanted to invite a patient to upload, you would hit a separate tab. Let's look at the inbox first. You go to the inbox, you pick a patient. In our case, it's a test patient, but you'd have the patient's name and the study. We click on the study to view it, and you can see it's very quickly it launches a viewer. This particular viewer has the patient's name up on top and the study dates, and you just pick any study you want. T2 coronal images, you can see load very quickly. Then you'd go down to the bottom and you could tab through the study, which is very, very fast, much faster than a CD-ROM. You can change the windowing by clicking over here. You can change the contrast by clicking here, and if you zoomed it up to 200% size, then you can move it around by clicking the hand and moving the images around. And so we'll go back to the regular screen size. And then finally, when you want to move it to your radiology information system, you click here, and that gives you the opportunity to load it up to your radiology information system. If the visit number is not already there, which the scheduler can do, you can add a visit number. It's optional, and you can click it. And if you want to have it reviewed, you click the second box that says what is the clinical question for the radiologist. So in this case, I'll put in headache for 3 months. And I'll send it to the radiologist by hitting next. It says I'm going to send this to the archive and have it formally reviewed. Yes, here. The next question will be, do you need this stat? No, I don't need it stat, or yes, I do. Normal turnaround time is typically 72 hours. So I'll hit OK and send it to the archive. In this case, I'm not going to do that. I'm going to stop. But it would go to the archive. You can hide the clinical information, the patient's name and registration number, by just hitting that button. And that's it. It's very easy to use. If they had more studies, they would show up here on the left. The subsequent videos will talk about the radiologist's role. There's some videos on the scheduler's role and how to invite a patient. But I will show for physicians, if you want to invite a patient, you could do that very easily by choosing the care team and putting the patient's email, patient's registration number, patient's first name, patient's last name, and patient's date of birth as a 4-digit year. And this will then send the invitation to the patient And please see the other video on invitations if you'd like. Patient gets an email. I'll show you a copy of that. There's a sample script if you want to talk to the patient on the phone, and the script that you might do when you talk to the patient on the phone is right here. This is the script you may use. Thank you.